So in this video, what I would like to do is to talk about a program called the Diabetes Prevention Program. And what this program has been done is it's been shown that this program can actually prevent type 2 diabetes. So I'd like to review that data with you. So the data for this particular intervention was a randomized clinical trial. There were over 3,000 subjects, and their target group were those people who had a high BMI. So remember that 25 is the cutoff for being overweight. So they were at the high end of normal or more, obese and overweight, and they were all pre-diabetic. And remember, in pre-diabetes, you have a high blood glucose, basal blood glucose levels, and you also have high insulin. So those are the early signs of pre-diabetes. So they were on the cusp, and what they wanted to know was, can we intervene and get these people to stay at that pre-diabetes level? So what they did is they assigned them to one of 3 treatments, and they used random assignment. Their placebo group, they took a daily pill that looked just like one of the drugs that they were giving them, and then they also did some lifestyle counseling, and we'll talk in a minute about what that was. And then in a second group, they also did the same lifestyle counseling, but they also gave them a drug called glucophage. One of the things that they wanted to do was to compare the effectiveness of their intervention to what you can get from a drug alone. And this drug has been shown to lower blood glucose levels. And then the treatment group was a program whose goal was to get these patients to lose weight. And how they went about it was a little bit different than the standard lifestyle counseling that they had. So this was their treatment group. So I want to talk about what the difference was between these two. So what they did is, for the standard lifestyle education, the ones who took the drugs, the ones who took the placebo, they pulled them aside and gave them a counseling session where they said, you know, we want you to change your lifestyle, and what you want is you want a healthy lifestyle. For the weight loss intervention, what they asked the people to do was to reduce their weight by 7%. That was the goal. So for the standard lifestyle education group, they had a single 20 to 30 minute meeting, and the advice that they gave them was pretty much the advice that you're getting in this course, which is to follow the food guide pyramid, which was the equivalent of my plate at the time. And they asked them to reduce their weight, saying you should do this, and you should particularly focus on lowering your cholesterol, because that was at the time one thing that you could do to improve your health. And then they also said you should increase your physical activity. Compare that with the weight loss intervention. In the weight loss intervention, they met with them for 24 weeks. There were 16 lessons that were taught either alone or in combination. And so it was a course that you took on how to reduce your weight. The diet that they put together for them, the emphasis was not on cholesterol, lower cholesterol. It was low calorie and low fat. So it was a weight loss diet, and the primary target that they had was the amount of fat in the diet, since fat has more calories. They also gave them a goal of you will increase your physical activity to 150 minutes per week. So lowering the weight and increasing physical activity was the goal, two goals. For the standard lifestyle, as I said, they had just one meeting with them, and they never did any follow-up with them about how they were doing, so there was no reinforcement. In contrast, in this weight loss intervention, after they did the teaching, they had monthly individual sessions and then a few group sessions with case managers, depending on the load. So the follow-up, keeping them on track, taught them how to do it, and then stayed in touch with them to give them coaching afterwards. So how well did the programs work? So what they did is they checked in with them. Looks like they did it about every 6 months. This is years after the start of the program. And they monitored their weight relative to their starting weight here at the beginning of the program. And then they also asked them to just keep a log of their exercise. And from that, they calculated how much activity in hours per week. So what you can see is that for those people who had the lifestyle intervention with the comprehensive counseling, that their physical activity increased, and this is a unit hours per week, but it increased significantly, and there was some slacking off, but at no point did it return to the levels with the placebo. Also notice that the people who were counseled, you should increase your physical activity, did so. So there was a peak here and they increased it, but then they tailed off and it never reached as much as the target. So how effective was this change in physical activity and diet? For the placebo group, they really didn't lose any weight. They didn't gain any, but on the other hand, they just sort of maintained. The people who took the drug reduced their weight a little bit, 2 kilograms, but the most dramatic weight loss was seen with those people who received the intensive counseling. And it's typical with any weight loss program. You see a drop in the short term. It lasted about a year, and then after about a year it started to creep back up again. But at no point did it return to what it was before they began the program. So I want you to pay attention to the data here at 1 year. This 1 year mark was the point where you saw the most dramatic increase in physical activity and also the most dramatic drop in weight relative to the placebo and the drug alone group. All right, so that time point, that 1 year time point, is the time point with maximal compliance. So that's where they were doing what they wanted to do. So if you look at the percent of the people in that study who came down with diabetes in the subsequent years after the study began, they followed them and counted the number of people in the various groups who had diabetes. And at 1 year, which is right here, here is the people who took the drug, here is where the lifestyle people were, and here is where, let's see, I think the blue is right here. There really wasn't that much difference between whether or not they had diabetes at 1 year out. So even though they've got maximum diet changes, maximum weight loss, the place where you see the dramatic difference is 4 years out. At that point, the people who were following this weight loss program had the most lowest rates of turning that pre-diabetes into diabetes compared to the people who were taking the drug and compared to the people who were just told lose weight, eat a healthy diet, things like that. So the net effect of this lifestyle intervention was that it reduced the incidence 4 years out of diabetes, progression from pre-diabetes to diabetes, by 58%. And then when they broke that down further, the rates were higher for seniors, which is a group that is particularly at risk for type 2 diabetes. So the conclusion from this study is that how you deliver the message, which we all know we should do, that you need to lose weight and you need to increase your physical activity, how you deliver that message matters. It matters a lot. So let's look at what it was that they did. Once again, in both cases, they were counseled to reduce weight and to increase their physical activity. But for the weight loss intervention group, they gave them a specific target and worked with them on building a plan for how they were going to get there. And then they had follow-up meetings with them so that they could track and do reinforcement and to help them to reach their goals. So based on this program, which is called the Diabetes Prevention Program, or the DPP, in 2012, the NIH awarded a $10 million grant to the CDC, and the CDC is now in the process of looking for partners in the community to go out and deliver this same curriculum that the DPP study used. So right now in Maryland, there are two places that I'm aware of where they are beginning to offer this curriculum. One is at the University of Maryland Baltimore Medical Center, and then the other is at area YMCAs. And I know about this because I happen to see the announcement of this program at my gym. So I'm imagining that there are other centers around the state that are also doing the same thing. So this is an example of what public health looks like, initiatives that aim to improve people's health through effective public education programs.